Let's start with a brief description of diabetes. So what is diabetes? Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Also, there are some study results of diabetic patients mentioned below. There are mainly three types of diabetes. First, type 1 diabetes. This is characterized by loss of the insulin-producing beta cells of the pancreatic islets, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. Next is type 2 diabetes, the most common one. It affects how your body uses sugar, glucose, for energy. It stops the body from using insulin properly, which can lead to high levels of blood sugar if not treated. There is a very thin line between pre-diabetic and type 2 diabetic. The third one is gestational diabetes, mainly affecting pregnant women. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. So what are the common causes of diabetes? 1. Insulin resistance. 2. Autoimmune disease. 3. Hormonal imbalances. 4. Pancreatic damage. 5. Genetic mutations. This is not so common. Mainly found in infants. Let's discuss about the symptoms: increased thirst and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cuts, frequent skin and or vaginal yeast infections. There are more symptoms associated with diabetes, but these are the common ones. Diagnosis for detecting diabetes. Diabetes mellitus is diagnosed with a test for the glucose content in the blood, and is diagnosed by demonstrating any one of the following: 1. Fasting plasma glucose level. 2. Plasma glucose level 2 hours after a 75-gram oral glucose load. Other methods are also available like random test, HbA1c test. Blood glucose chart as per American Diabetes Association. You can take screenshot of this chart. What are the long-term complications of diabetes? First, cardiovascular diseases can occur. Second, there will chances of diabetic neuropathy. Also, long-term diabetes can damage the kidneys, which leads to diabetic nephropathy. Diabetic retinopathy, which can damage blood vessels of eyes. Also, infection in skin and mouth can occur. Sometimes, prevention is better than cure, and this statement is very much true about diabetes. These steps we all can take to prevent diabetes because there is very thin line between pre-diabetic and diabetic. Please have a look. Lastly, I can conclude by saying that, with a little bit change in our daily lifestyle, we can defeat diabetes.